Welcome, everyone. My name is Ivory Allison, and I am the National Director, Community Impact for the American Liver Foundation. And I'd like to be the first to thank you for joining our Life with Biliary Atresia and Beyond webinar series. I'm excited to share that today we are joined by Leanne King, who is our featured speaker. And I will introduce her in just a second, but first I'd like to quickly go over a few reminders. Today's Life with Biliary Atresia and Beyond webinar series is being delivered on Zoom and will be recorded. We'd really appreciate if you could mute yourself during the program and to avoid any disruptions while our speaker presents today. If you do have something you want to share or have a question, please utilize the Zoom chat feature and share your thoughts that way. Again, please note that this program is being recorded and will be shared on ALF's private Life of Biliary Atresia and Beyond Facebook group for folks who might not be able to join us live. I'd also like to take a moment to acknowledge our generous sponsor, Albireo, for their support of the American Liver Foundation's Biliary Atresia initiative. We are grateful for their ongoing support of this new program. So now I'd like to introduce our featured speaker today, Leanne King. She is a pediatric liver, cardiology, and heart transplant dietitian at Duke Children's Health Center. She completed her undergraduate degree in nutrition at the University of North Carolina at Greensboro. She completed her graduate degree at Tufts University and her internship at Francis Stern Nutrition Center in Boston, Massachusetts. She currently lives in Greensboro, North Carolina with her boyfriend and their 2 cats and 3 dogs. Thank you, Leanne. We will now have you take over the program.
Okay, thank you. All right, there we go.
Perfect.
So thank you for introducing me, and I'd like to thank you, Ivory, and the American Liver Foundation team for inviting me to join your meeting tonight. I'm happy to be here. So as Ivory mentioned, I'm a pediatric liver and cardiology dietitian at the Duke Children's Health Center. And I have the amazing opportunity to work with a great group of physicians, nurse practitioners, nurses, and other dietitians who I've learned so much from since I've been here. So I'm excited to talk to you all a little bit tonight about nutrition for biliary atresia. So I just want to go over a few disclosures. I have no financial disclosures or conflicts of interest. The material presented reflects my own professional opinion of current research regarding nutrition for biliary atresia. And the following slides are not meant to be used for diagnosis or treatment of any medical conditions. And I recommend you follow the advice of your medical team because they know you and your children best. So tonight I'll be going over a few things. We'll kind of go over just a basic introduction of biliary atresia, the role of a dietitian on the treatment team. We'll talk a little bit about what malnutrition is and how biliary atresia can affect nutrition status. It has a very big impact on our nutrition. We'll talk about some common nutrition interventions that you may see your team using, and then what nutrition is like post-transplant. And if at any point along the way you want to stop to ask a question or talk about something, you can stop me at any point as well. So now we'll talk just a little bit about what biliary atresia is, and I'm no expert on this compared to the physicians that may have presented before, but we'll just do a basic introduction because it'll kind of tie into when we talk about the interventions, why the interventions are so important. So basically, biliary atresia is a condition in infants where the bile ducts are scarred and blocked. The bile ducts carry bile from the liver to the gallbladder for storage, and then to the first part of the small intestine, which is called the duodenum. The bile acids are then used in digestion and absorption. When infants have biliary atresia, the bile can't flow to the intestines, so it builds up in the liver and can damage the liver. This damage leads to scarring, loss of liver tissue and function, and cirrhosis. Early treatment of biliary atresia with a Kasai procedure may slow or prevent the damage to the liver, development of cirrhosis, and liver failure. Even after the Kasai procedure, about half of children with biliary atresia will need a liver transplant by age 2, and 2/3 will need a liver transplant sometime during childhood. During the procedure, a surgeon removes the damaged bile ducts outside the liver. A loop of the infant's small intestine is used to replace the damaged bile ducts, which allows the bile to flow from the liver to the small intestine. So just a basic overview. And then we'll talk a little bit about the role of a dietitian on the treatment team. So your team may involve physicians, nurse practitioners, physician assistants, nurses, pharmacists, and then a dietitian. In children who are post-Kasai procedure or awaiting a liver transplant, nutrition is very important because maintaining optimal nutrition can help decrease surgical risks and also helps maximize the success of the procedure. So some things you might see your dietitian participating with is monitoring growth. So we'll monitor weight, length, head circumference, weight for length, or a BMI for age, depending on the age of the child. We'll measure mid-upper arm circumference, which I'll talk a little bit in the next slide, and complete a nutrition-focused physical exam as appropriate. And the nutrition-focused physical exam is basically just a head-to-toe exam where we look at muscle mass, if there's any loss of adipose tissue, any fluid accumulation, and it can also help us identify micronutrient deficiencies, which is very helpful as part of our nutrition assessment. From that information we gather during the assessment, we'll screen for malnutrition, and then we'll work with the family and the team to develop a nutrition plan of care to treat or prevent the malnutrition, support appropriate growth, and treat any micronutrient deficiencies that may be occurring. At some centers, you may see your dietitian at the same visit that you see your liver doctor or your hepatologist, and at other centers, you may see them in a separate visit. So here is a slide about the mid-upper arm circumference. You may have read about this online, or maybe your dietitian or someone on your team takes these measurements. But basically, whenever we're measuring a mid-upper arm circumference, we first want to find the midpoint of the arm between the shoulder cap and the elbow. Then at that midpoint, we measure the circumference around the arm, and we can plot that measurement on growth charts to obtain a percentile for age and a Z-score, which helps us compare the nutrition status. Weight alone may not be a reliable indicator of nutrition status, as it can be influenced by an enlargement of the spleen or liver, ascites, and/or edema. Patients who are malnourished will have a lower mid-upper arm circumference measurement because they'll have less muscle and subcutaneous fat in their arm. As nutrition is treated or corrected, the mid-upper arm circumference measurement will increase as muscle mass and subcutaneous fat stores increase. This measurement can be inaccurate if there's an extreme amount of edema present in the arm. Typically, the measurement is completed on the right arm. However, if it is completed on the left arm to start with, it's best to keep trending the same arm. So you may have your left arm trended or your right arm trended over time to monitor growth. And now we'll talk a little bit about what malnutrition is. This definition is taken from the consensus statement on pediatric malnutrition. It's an imbalance between nutrient requirements and intake that results in deficits of energy, protein, or micronutrients. And these deficits can negatively affect growth, development, and other relevant outcomes. Malnutrition can be acute or chronic, and it can range from mild to severe. The most important takeaways from this is that it's that balance between the requirement and intake, and both of those are affected by biliary atresia. We diagnose malnutrition by looking at the adequacy of calorie intake compared to estimated needs, weight gain velocity, which is basically how fast or slow you're growing, compared to norms for age, length measurements, which can help us look at stunting, which is more of a chronic malnutrition, and then weight for length or BMI for age, depending on the age of the child. And then of course the mid-upper arm circumference measurement we talked about earlier. So all of those can help us determine the diagnosis of malnutrition. It can develop very, very quickly in infants and children. And one takeaway I want you to know from this presentation is that it's not your fault if your child develops malnutrition or gets that diagnosis. There's so many factors that can contribute to malnutrition in patients with biliary atresia, and we'll discuss some of these factors during the presentation and interventions that will be used to help prevent or treat malnutrition. So on this slide, I made just kind of an overview of just some of the factors that can affect nutritional status from biliary atresia. Overall, there's an increased risk for the development of malnutrition. There can be inadequate intake from a variety of factors, including loss of appetite, altered taste perception. So both of those are going to make the formula or whatever the normal nutrition is not as appealing. There can also be nausea and vomiting, which not only does that make us not want to take in formula or normal nutrition, but it also can increase losses. So what we take in, we're not necessarily getting all of that. Also, there can be a feeling of feeling full very quickly. And then, of course, gastroesophageal reflux disease. So all of those can affect how much we take in. And then on top of that, we have increased needs. So there's increased calorie and increased protein needs in biliary atresia. So that kind of relates back to that balance between the needs and the actual intake that we talked about on the previous slide with the malnutrition. And then on top of all of that, there is sometimes maldigestion or malabsorption. So there can be diarrhea, fat and fat-soluble vitamin malabsorption, and all of that can impact the development of malnutrition. So now we'll go into some common nutrition interventions that might be seen in biliary atresia. One of the first things the team will try to work on if they see that growth may be slowing or falling off the growth curve a little bit is they may try to increase calories and protein in a number of different ways. Infant formula or expressed breast milk we can use different strategies to increase the fortification. And this provides more calories and proteins to meet the increased estimated needs. Ideally, we like to use formulas with at least 50% of the fat calories from medium chain triglycerides. We'll talk a little bit more about why in the next slide. But of course, with the national formula shortage this past year, that can be difficult to find a good formula that's well tolerated, supports good growth, and is able to be found in the home setting. That has added some difficulties. There's a lot of different ways that this fortification can be done. So in an infant who is being breastfed, bottles of fortified formula or high calorie formula can be added in addition to the breastfeeding. So that way the breastfeeding journey can still go on. If a patient is receiving expressed breast milk in a bottle, formula or modulars like MCT oil can be added to increase the calories or nutrients provided. If a patient is formula fed, your medical team may provide a different recipe for you to mix your formula with, and it'll be different than the recipe on the back of the can. And it provides a higher ratio of powder to water, which basically increases the calories and protein in the same amount of volume. And there'll be all different levels of calories and different recipes that your team may give you. You can also use high energy supplements like a glucose polymer powder or MCT oil, like we mentioned earlier. And your medical team will pick the best option for you or your child to best support their growth. And now we'll talk a little bit about why MCT oil and infant formulas that contain a high amount of MCT are preferred. So this slide goes over some basics of fat absorption. There's different types of fatty acids. The two we'll talk about are medium chain triglycerides and long chain triglycerides. So on the right side of the slide, it goes over the process of digestion and absorption of long chain triglycerides. Malabsorption of these long chain triglycerides can occur in biliary atresia due to a decreased concentration of the bile acids in the intestines from the scarring and blockage of the bile ducts. The bile acids are needed for digestion and absorption of the long chain triglycerides. So you may see things like fat malabsorption, and that could look like steatorrhea, which is an oily stool, or a bulky, frothy, loose stool. However, on the left side of the picture, the medium chain triglycerides are absorbed faster than long chain triglycerides, and they're taken directly into the portal system and transported to the liver without the need for bile salts. Medium chain triglycerides are also not stored as adipose tissue, which is fat tissue, but instead are rapidly metabolized to be used as an energy source. So using MCT oil or formulas that have a higher amount of MCT oil can add fat and calories while minimizing fat malabsorption. After your team has tried a lot of different strategies to help increase calorie and protein take that's able to be taken in by mouth, there may come to a point where a little more support is needed, and that's where nutrition support would come in. When possible, we like to use the GI tract. So you may hear your doctor or your team say, if the gut works, use it. And that's always best. So one of the first things that may be tried is a nasogastric feeding tube. And basically that's a small flexible tube that's inserted from the nose and goes down to the stomach. It can be used to deliver breast milk, formula, medications, and depending on the age of your child, water, if they're above 1 in water is needed, if they're unable to take enough of these things by mouth. In some cases, when feeding into the stomach from the nasogastric tube is not tolerated, the tube may be advanced further into the intestines, into the small intestines to deliver the nutrition. So these tubes may be called nasoduodenal tubes or nasojejunal tubes, depending on where in the small intestine the tube terminates or ends. G tube or gastrostomy tube placement is not recommended in biliary atresia, and that is the tube that would be inserted directly into the abdominal wall into the stomach, and that can be done by like a surgeon or during an endoscopy. And these are not recommended because the likelihood of developing portal hypertension and the increased risk of significant GI bleeding from the portal hypertensive gastropathy and gastric varices. Then if enteral nutrition and oral nutrition is also not working, parenteral nutrition, or sometimes called TPN, may also be utilized. Parenteral nutrition, or TPN, is a way to deliver nutrition without using the GI tract. Fluid, carbohydrates, protein, lipids, micronutrients, everything that's needed is delivered directly into the vein, and your child's TPN prescription is customized to their needs. It may be indicated in cholestatic infants with biliary atresia when tube feeds are felt to be unsafe, such as severe varices, GI bleeding, ongoing vomiting, or if there's inadequate weight gain on maximized tube feeding and everything else has already been tried. Another really important intervention is the monitoring and supplementation of fat-soluble vitamins. Fat-soluble vitamins are vitamin A, vitamin D, vitamin E, and vitamin K. There's an increased risk of deficiency in cholestatic disorders like biliary atresia due to that fat malabsorption that we talked about earlier. Your team may use special multivitamins with high levels of fat-soluble vitamins, or depending on what is low and what isn't, they may supplement individually. The levels will be monitored at regular intervals and the supplementation will be adjusted as needed. And then we'll just briefly go over nutrition post-transplant. So immediately after transplant, early nutrition will likely be initiated. And that's to address any preoperative malnutrition that may have been present, the stress from surgery, and then the increased catabolism and increased calorie and protein needs after surgery. The initial goals after transplant are to support your child's nutritional needs after surgery and help ensure adequate wound healing and healing process in general. They may need to continue nutrition support after a transplant and slowly wean over time. Supplemental nocturnal tube feeds, which means nighttime tube feeds, may be required for several months up to several years post-transplant. And that's because some infants and children who receive tube feeding pre-transplant may not have developed normal feeding practices, and they may have missed developmental milestones for chewing and swallowing. Working with feeding therapy can help increase the intake of nutrition by mouth. And as that occurs, the tube feeding can then be slowly taken down and weaned over time. After recovery, typically a healthy, balanced diet that's normal for age can be started. And extra supplementation that's added pre-transplant may no longer be indicated. Children with biliary atresia typically experience catch-up growth following liver transplant. So if there was any malnutrition or slow growth beforehand, you may see a quick increase in weight and a quick increase on the growth chart, which is basically catch-up growth that they were missing out on beforehand. And then after transplant, there's an increased risk for foodborne illnesses due to the immunosuppressants that are taken. So your dietitian or team will likely review food safety guidelines with you and go through everything that will need to be followed post-transplant and give you a lot of resources on that. Here are some of the references that I used to make these slides. And then these are some great resources that have some more information on biliary atresia. And does anyone have any questions or want me to go back over anything?
Wow, Leanne, that was great information. I know I definitely learned a lot, and we are opening up to the floor. For anyone who's new with us tonight, we do like to make this a little bit more engaging, so you can type in the chat or you can just raise your hand and speak up. And so I think Jen, I don't know if it's Jen or Jen.
Yeah, it's Jen, like Jennifer.
Jen. Welcome, Jen. Go ahead.
Hi, thank you for this. I have a question about older children. I have a 15-year-old who has biliary atresia, pre-transplant. Well, it's knocking on my head. And I'm wondering.
In there.
I hear at times over the years about importance of zinc, importance of maybe magnesium, and I'm just wondering. I mean, we go to his visits every 6 months, and you know, he's growing, he's on his curve, he has like a typical teenage diet. I'd like it to be better. But I'm curious to know, like, do you know anything about these rumblings I hear about zinc, maybe magnesium? I can't remember all of the different elements. that have come in through conversation over the years?
Yes, there are absolutely other micronutrients that are at risk for deficiency in biliary atresia. So it could be zinc, magnesium, calcium, and a lot of other micronutrients that could also be deficient in addition to the fat-soluble vitamins. So your team may monitor those levels periodically, or they may just have your son take a general multivitamin, which will help meet the average needs for age. If there are deficiencies found, sometimes supplementation with a higher amount than the DRI for age is needed.
So that's something like these things could be monitored with his labs that are drawn. Is it possible they're looking for these things when they draw blood?
It's possible. They may be targeted towards nutrients that they might be concerned for. So for example, if the dietitian is speaking with you and they notice that there may not be intake of foods that are good sources of iron or zinc, that may be something they talk to the team about checking and making sure that everything looks okay.
Okay, thanks.
Again, if anyone wants to come off mute, you can jump in with a question or comment, something that might have been helpful for your child or children. We did have a question coming from our Facebook group. She said, I have issues getting my child to eat vegetables. I do the toddler pouches, but I'm not sure if that's enough servings for a 2-year-old. Any suggestions would be helpful.
Yeah, so there's a lot of different resources that your dietitian can provide, or anyone on your team, about normal nutrition for age. So depending on the age of the child, we have guidelines for typically like the serving sizes and goals to aim for each food group. So that's something, if they want to email me, I can like send them the handout as well, and we kind of just give them information on food group goals for age and things to aim for. And there's all kinds of tricks that we can help with helping to increase intake of fruits and vegetables that look more appealing for toddlers and children.
That's good to know. Is there a recommended diet post-transplant? For adults, sometimes when we're trying to, add healthier items to our menu, we look at the Mediterranean diet, or we're looking at is there any specific diet that is helpful?
So it can depend on the patient and what's going on. So some patients may still be struggling with weight gain, or so they might need like a more high calorie, high protein focus, or if there's any concerns about weight management or dyslipidemia, it's kind of tailored to what's going on with the patient. But in general, just a general healthy diet and meeting our different food groups goals for age and making sure that we're getting a well-balanced diet is the most important.
And I might add, I'm a father, but my eldest son is now in his 30s, but he was BA and post-transplant, and now a father of 2. But keeping a daily journal may be helpful. So when you go through some of these milestones or you're having challenges, it helps to document. So when you're going through with your healthcare provider, you can go through some of the things that you've either had challenges with, or you notice something, and vice versa too. When they go through different things, you can jot down different notes of things that you need to follow up on, when you're back home.
Yeah, that's a good point. Especially, keeping a journal is definitely helpful as you go to the hospital and their doctor's visits, but even just for their diet, right? To see what they like, they don't like.
Absolutely. Stuff you can document, so when you're going through with your healthcare provider, it's something you can bring up to, hey, they like this, they don't like that, or we've had challenges with getting this certain intake of certain, vegetables or different things, or, so it's just, we found it very helpful in managing, his care.
A question that came through to me in our chat is, besides water, what are healthier drinking options that don't have lots of sugar?
Well, that's a good question. So water intake is another thing that can be really hard. And that's something that we like to focus on. So making sure that we get some good water intake. If water is difficult, you can try strategies like choosing a new container that's appealing, maybe a container with a straw, or trying ice water versus room temperature. And then if none of that works, it's best to choose options that are sugar-free. So maybe like a sugar-free liquid drop added to the water, sugar-free powder, or you can even use fruit and infuse the water with the fruit to add a little flavor. So there's a lot of different options that can be considered.
Or splash flavored water.
That's good. I've never heard of liquid drops. Like I said, I don't have any kids, so I've never heard of the liquid drops for kids. So that's good, a good option to put out there. And someone wanted to know, can they still breastfeed after a Kasai procedure?
Yes, it depends on your team's nutrition plan and what's going on clinically. But if there's no contraindications, like if there's no swallowing difficulties or anything like that, it's absolutely, you can breastfeed and it's recommended. It's great. It provides really good nutrition. And there may still be some things in addition to the breastfeeding if needed by the team.
I wanted to say, once your child, maybe pre or post transplant, you can let me know, and maybe they're in grade school, like they're in school, they go to school, they're school age, and is it something that you would talk to someone at the school if it's lunches at the school, unless of course you make your own lunches for the child, but is it something where you would go to the school and discuss this with them to make sure that they're eating the right foods and getting the proper nutrients?
The parents or the team?
Yes, the parents going to the school to make sure, yes.
So a lot of times what we'll do is while we're in the visit, we'll pull up the school website and we can look at the options on the website. So it's something we can talk about during the visit. I know there's also forms that can be filled out with the patient's care team, but I'm sure that if the school is open to that, parents could also go and talk about options and maybe get the forms filled out in person.
That's great to know. I think that goes back to your point of it's a team, you know, utilizing your team and connecting with them is perfect for the parents and the family. Someone had a question. It's not diet specific related, but what types of over-the-counter medications are acceptable to give the child if they have a cold or some other non-critical illness? Is that something you can answer? If not, we'll put that to someone else.
Yeah, I don't know if there's someone on here that can maybe answer that question. That is out of my scope of practice.
No worries. And Dr. Mavis just left, so she was able to answer that.
Being a BA dad, I would say it's always best just to review with your healthcare provider or nurse professional practitioner versus other people that you know, because it may or may not be following proper procedures. So it's always best just to go to your medical professional or nurse practitioner that's following your care if you have questions on that.
No, absolutely.
Yeah, I know too, there have been times when I cross-reference everything that my son's pediatrician, here, sorry, let me put my video on. I cross-reference everything that my son's general pediatrician says with his hepatologist, always down to like the most benign thing that you could think of. And there have been times when even a certain allergy medication might have a contraindication that we never would have thought of, or an essential oil that we had a question about that his hepatologist said, stay away from that. So I agree. I think consulting with the specialist for everything is probably best practice.
Yeah, they expect it. So you're not imposing upon them. They expect it.
Yeah.
I was gonna speak to that also. I'm Brandy. I'm actually one of the pediatric liver nurses here at Duke. Sorry, I don't have my video on. My children are being a little wild. But we are used to, just to piggyback off of what the parents have said, we are used to getting every single phone call of, can I have this? Can my child have this? What is your thoughts on this? Because it is true that supplements, some of them that you think you're giving because the internet or your pediatrician says that it may help, can actually be harmful to the liver. So, you know, any of the combination meds that have Motrin and those sorts of things, you know, you don't want to just give your child those, whereas you may have given it to your other children that don't have a chronic liver disease. So always, always, always contact your hepatologist or whoever is managing your child's care, even outside of the pediatrician, because we're used to it and it's not bothersome. And we would, even antibiotics, that's another big one. Most of the time it's fine, but sometimes it's not, or there's other things we need to monitor or look for. So never feel like you are being burdensome or a problem. We are used to it and really appreciate it.
Yes, I love hearing that. Thank you, Brandy, for that. It's really good information. Now, Leanne, are there any particular types of foods that parents should avoid with their children pre or post who have BA?
So typically, in thinking about avoiding foods, it would be along the lines of just if it's something that's not tolerated, maybe if it's post-transplant, we want to stick with a more general healthy diet. So we want to try to avoid too much added sugars, too much like highly processed or salty foods, too much fast food or greasy foods. So it's just kind of typical healthy nutrition, unless there's something specific that needs to be avoided for another medical or nutritional reason. And that's where the individualization really comes in, where we take a look at the whole picture and can help at each visit coming up with a nutrition plan.
That's good info. And another question in our Facebook group was, well, two questions. One, should my child have a high diet of protein? And the second question is, what should I do if my child isn't eating enough vegetables? I think that's all kids, right?
Yeah. Yeah, so the protein question, yes, there are increased protein needs in biliary atresia. So we'll use some of those strategies that kind of mentioned in the presentation to help meet those increased needs. Or in an older child, we'll do a lot of education on a high protein diet and how to meet those protein needs. Sometimes even in older children, there may be a need for nutrition supplements like that are taken by mouth or provided per a feeding tube if there's a feeding tube still in place. So protein is very important. And then for vegetables and trying to increase vegetable intake, there's a lot of different strategies that can be used. And once again, I have like handouts if someone wants to email me, I'm happy to share those. But a lot of it is encouragement and offering the vegetables and offering a wide variety of vegetables at meals, trying to have a set meal pattern, set snack pattern, and just knowing that it can take a long time of introduction and trying new things before they're accepted.
That's really good idea. And I just want to put it out there again, I'm not a parent, so what I'm about to say, sometimes I think maybe I have a lot of little nieces, but I think maybe in anyone, you know, Jen or Reed or Natasha, anyone, Alan, I think sometimes maybe inviting the kids into the kitchen while you're cooking to kind of get them involved in it. And I know that's a hard thing, and parents are so busy and a lot going on. So maybe if it's one day a week or one day a month, just to get them involved so they kind of see what you're putting into the food and kind of make it a little bit fun for them. So that way they're more interested in maybe the vegetables and, you know, putting a little, you know, scarf on it as a carrot or something, you know, and I know it's a lot, but just to get them a little bit more involved in it and even opportunities where they can, take the vegetables and put them in a blender and blend them up, and getting active into the kitchen so that they know what they're eating, and kind of maybe allows them to get involved in their own little menu, so that they know, oh, I remember when we made those carrots with the such and such, we have that again.
Yeah, that's absolutely true. And then also involving at the grocery store too and picking them out, or the farmer's market, that's really helpful too.
No, that's true. That's true. Make them feel a little empowerment with that.
Yeah, sometimes with the little ones having their own little cart that they can help fill with the
Yes,
little
I
stuff.
know at Target now they have the miniature carts for kids, so so they can feel very involved, putting their fruits and vegetables, and
Right.
of course a couple of cookies and snacks. Are there any recipes that anyone, anything that has helped anyone on the call? I won't call anyone out. If you feel comfortable typing it in the chat or coming off the mute and saying anything in particular that has kind of helped with your own child or children when it comes to their diet and nutrition. Are there any recipes? Oh, go ahead, Natasha. Oh.
I wanted to ask you something. My baby usually have hard stool, opposite of diarrhea. So I give her a lot of vegetables, fruits. Also, she takes some syrup, some. To help her to have better stool, but still she had the problem with the stool. Hard.
So
I
that,
don't know.
yeah, that's a great question. That's something to definitely bring up with your team. Your team may have the dietitian help with looking at there's a few things nutrition wise we can look at, like if they're getting, like you mentioned, fruits and vegetables for fiber and fluid. But other than that, the doctor may be able to help with some different bowel medications and bowel regimens to help with that. So that's definitely something to bring up with your team at your visit.
Mm-hmm. Okay, thank you.
Mm-hmm.
That's not real.
Yes, it is. Look.
They have something. Sorry, that was my children.
No worries, Brandy. Are there any, Leanne, any resources, and hopefully you'll be able to email me, any websites or any particular books that you think are helpful?
I don't know of any books geared towards parents, but that's something I can look into. And then I can definitely email you the websites and some of the handouts we talked about today that can be shared with everybody.
That would be great. That would be excellent. Does anyone else have any questions or comments or anything that they found helpful, or something that was maybe a hurdle for them to get over that could potentially help anyone else? No, I think I think we're good. Any final comments, Leanne?
I'm just grateful for you guys inviting me. It's been great to be here with everyone. And if anyone does think of any questions, you can always reach out and I can try to answer anything that comes up.
Wonderful. Thank you so much, Leanne, for joining us. I definitely learned a lot, and it sounds like everyone else did. We will be putting up the recording probably after Thanksgiving on our Facebook page. But of course, guys, go on and continue the conversation. Post in there some recipes that have helped or that your kids have really loved and you think others might, or something that has become difficult for you with your child. Maybe they absolutely cannot take the water, they don't like it, so they might not be getting enough of that. Definitely let us know. Again, we appreciate everyone for joining us and our sponsor, Alberio, for supporting this cause, and for Leanne. Thank you all so much and have a wonderful Thanksgiving.
Thank you.